Assalamualaikum and good day everyone. Our presentation today is going to be about the current pandemic, which is COVID-19. Well, basically, what is COVID-19? Well, COVID-19 is from family Coronaviridae virus. There are various types of coronavirus such as severe acute respiratory syndrome coronavirus, also known as SARS, and Middle East respiratory syndrome coronavirus, also known as MERS-CoV. And in late 2019, novel coronavirus were found in Wuhan, China, which is coronavirus disease 2019. This newly typed coronavirus causes pandemic around the world, with more than 5 million people infected and about 2 million recovered and death rate of more than 6% in 216 countries. In Malaysia, the total cases are 7,604 with death rate of 1.51% and total recover is 6,041. COVID-19 causes respiratory tract infections and potential to cause severe illness and death in the elderly, those having health problem, and also those with low immunity. So, how this pandemic actually happens? Okay, the virus actually can be spread to other people when the infected person sneezing or coughing. It also can infect us actually when we touch on the surface that have the virus. Among the symptoms of COVID-19, including of fever, cough, and also difficulty in breathing. And the severe symptoms lead to pneumonia and also kidney failure. But remember, some of the infected people do not have any symptoms or light symptoms. Until now, there is no vaccines or special treatment for COVID-19. The treatment are only given based on the symptoms. How this situation has changed us.
We start doing things from home and also virtually, such as online shopping, online learning, and also working from home. We also start to practice good hygiene. We practice good etiquette in sneezing and coughing, wearing masks when going outside, and also wash hands regularly. We start to realize how important it is to practice good hygiene. This current situation has also influenced our ways of thinking. Regardless of our political stance, everyone obey to the government's order. We also become selfless by helping the needy and giving out donations. We start to think of other people in a different way. For example, before this, we might view lower class workers such as safety guards, grab riders, and also cleaners as someone who have lower status than us. But now, they are the ones that fight for us outside, risking their health. We start to appreciate small things such as our times with our family that we take lightly before.
What we as a student can do to fight this pandemic. As a student, sure we understand this situation, so we can contribute to the country by become advocates at home and in the community, discuss about the virus and spread the way to prevent COVID-19. We need to limit our social interaction, although we are the young generation that love to hang out outside. Give cooperation by familiarize ourselves with the online learning through Google Meet or Zoom. Next, students should practice the 3W. Wear masks, wash hands, and warn from WHO, and avoid the 3Cs. Crowded places, confined place, and close conversation. We should follow the government rules so that we can be the role model at home to our siblings, our parents, and the community.
Along with the increase in COVID-19 cases, there is also a spread of fake news in Malaysia. Irresponsible netizens has been posting on social media such as Facebook, Twitter, Instagram, and WhatsApp on COVID-19 fake news. They intend to scare the public so that they become more careful. Some even do it for fun. This is all due to the lack of awareness on how dangerous fake news can be. One of the biggest consequences is panic buying. Panic buying will only lead to the increase of COVID-19 spread. Self-medication and unnecessary fear will also be caused by spreading of fake news. Reputation of country, authorities, and frontliners will also be damaged. Waste of resource in terms of police manpower. The government has been taking many action. One of them is a collaboration between police and MCMC in apprehending the fake news spreaders. Ministry of Health also has been making clarification on fake news through their social media. Enforcement of strict law is done by Ministry of Defence under Section 233 of the Communication and Multimedia Act 1998.
That's all from us. In this opportunity, we would like to thank frontliners for their services and appreciation also to our lecturer. Remember, stay safe, stay home, and stop COVID-19.